This is the Comfort LSO by Optimum Brace. It is a soft shell brace. It has rigid panels on the inside that have certain degree of lower doses for the patient's back. This is about 7 to 10 degrees, normally 15 to 25 is a standard patient. So what we would do is we take the panel out and heat it, and we end up with a heated panel with a degree of exactly like the patient's back. In her case, what we're going to do is put this one against her back. It has a front panel, side panels, and a back panel. So what you want to do is ask the patient which side they use, if they're left-handed or right-handed. And JC, you're right-handed? Mm-hmm. Okay, so we would pull this little tab. Very simple, it's a different color, so you can see it. Then you pull it around, open the whole brace, and you can see what it looks like on the inside. It has lateral panels for lateral support, which we can take down if the doctor does not want them on a surgical procedure. Easily they can come out. To begin with, we like to put them in for more stability while the patient is getting out of bed. Then we have the front that comes around the front. This front is available in 3 different heights. This for JZ is a medium profile height. It comes in shorter than that and taller than that. So we have one in the middle for her. And size is extra small through 5X. So we can fit just about anybody. So we have taken the brace apart just to show you the panel in the back. This is the one for a small patient, and we've got the lordosis on the back. We also have a pad. This is important because the small of the back will go here post-operatively. So hopefully the incision falls in this track, and the psoas muscles pick up the brace, and therefore the patient won't have any pressure on their spine. This is the first place to look if there's any problems with the fit. And then secondly, the exact lordosis that they may have. So once I've adjusted it with a heat gun, it would look something like this, except this is a wider patient from the back and from the side. So you can see now that you've got a really actual lordosis that is a little more pronounced. This is exactly like the patient's anatomy, and it fits snugly into the small of the back. So what we're going to do, and thank you, JC, is we're going to put this one in the pocket. Remember to put it against the back, put it inside that way, all the way down. Then you've got a piece of Velcro tab that you'll hold back against itself, and then you start with positioning the brace in the small of the back. Let's turn to the side. There you go, right about there. Center this to the front. Let us bring the small strap along the side and overlap it. So now turn to the side so they can see the front. Okay? So when you've got an equal fit, you want this to be positioned right about here, and you want the left to look about the same, this being in the very center. She can bring it down a little bit, just a hair, and now, while it's centered in proper position, you go ahead and take the bottom D-ring and pull to the front. Basically, you're snugging the back against the front. Take the bottom, go ahead and you do it this time. Good. To the top. Come down just a bit, good. And there you go. That's what it should look like, fitting her properly from the front, from the side, and from the back.